Hi, my name is Anna Krisick. I'm a pharmacist here at Riverside Health System. I'm here to talk about medication safety during your hospitalization. As you can imagine, medications play a very important role in this process. As part of your orthopedic team, I review your medications before your surgery. So whether you're taking blood pressure medicines or medication for asthma or high cholesterol, those meds are all reviewed before your procedure. I also look for any drug interactions and check to see if any dose changes need to be made. Lastly, I look to see if you have any drug allergies that might alter the choices and medications we choose to treat you. So that's why it's important to let your provider know exactly what medications you take, both prescription and over-the-counter, before your planned procedure. If you are taking the following medications, they will need to be held 7 days prior to surgery. You want to stop all aspirin, so any strength aspirin, and then aspirin-containing products. It's a little bit tricky because some aspirin-containing products are available as over-the-counter products, things like Alka-Seltzer, BC powder, Excedrin, Pepto-Bismol. These are meds you wouldn't realize contain aspirin, but they do. You'll also have to stop all non-steroidal anti-inflammatory drugs, which are known as NSAIDs. These are medications like ibuprofen, Motrin or Advil, with common names, naproxen, such as Aleve, any creams and gels that are over-the-counter for arthritis, including Voltaren gel, and some prescription medications like Relafin and Lodine. You'll also have to hold anti-platelet medications, which are prescription medications like Agrinox, which contain aspirin, and Effient. All vitamins and multivitamins need to be held, including omega fish oils and those types of products, herbal supplements, and any joint supplements such as glucosamine and chondroitin. Other medications to stop within 5 days prior to surgery are anti-platelet medications such as Plavix, Plital, and Brilinta. If you have a heart stent and you take Plavix and aspirin, your surgeon will work with your cardiologist about when to stop these medications. You also need to stop any anticoagulant medication you are taking, such as Coumadin, Xarelto, Eliquis, Pradaxa. Make sure you let your provider know about other medications you're taking, such as chemotherapy or biologic agents such as methotrexate, Enbrel, Remicade, steroids, or any hormone replacement therapy. So it's always important to be sure to review your medications with your physician, especially if you're taking meds for anxiety or depression. Another important component is blood clot prevention. To prevent a blood clot, your doctor may prescribe a blood thinner. You'll start this medication while in the hospital, and it will probably continue when you go home. One very effective blood thinner is aspirin. Low-dose aspirin, 81 milligrams, can be taken twice daily for 4 to 6 weeks. Your surgeon will determine if aspirin is right for you, or if you'll need medication such as Coumadin, Xarelto, or Lovenox, which is actually a medication injected into the abdomen. An important note that if you're on Coumadin, it requires special blood testing, which is called an INR. Just make sure that you don't take blood thinners together. So for example, you wouldn't want to take Coumadin with aspirin. You want to make sure you take your medications at the same time every day and watch for food interactions, especially with the Coumadin, and for things like signs and symptoms of bleeding. Also avoid alcohol use while taking these medications and avoid other over-the-counter medications unless it's cleared by your pharmacist or physician. We hope you found this video helpful. If you have any questions or need any more information, please contact your total joint nurse navigator.